This podcast is brought to you by NEMT Platform.
All right, so let's just cut through the noise today.
Sounds good.
We talk a lot about the cutting edge of healthcare on this deep dive. We've done robotic surgery, mRNA vaccines, AI diagnostics.
The flashy stuff.
Exactly, the flashy stuff. But there is this massive gaping hole in the infrastructure that arguably impacts patient outcomes way more than any new pill.
Oh, without a doubt.
And it's just the simple logistical nightmare of getting a body from point A to point B. So I want you to imagine a scenario for a second.
Okay.
You have a crucial doctor's appointment.
Right.
Maybe it's physical therapy, maybe a routine checkup.
Right.
But you physically cannot drive yourself. And it's definitely not an emergency, so what do? Calling an ambulance is total overkill and wildly expensive.
Oh, absolutely.
But a standard taxi or a ride share might not be able to handle your wheelchair or, your specific medical needs.
Right, and it sounds mundane until you actually look at the data. I mean, we were talking about a massive no-show epidemic. Patients missing dialysis, skipping physical therapy, or even delaying chemo simply because they cannot physically drive themselves. And the public transit system, if it even exists where they live, just can't handle a wheelchair or a post-op patient.
And that is exactly where the system bleeds money. Because a missed appointment isn't just an annoyance.
No, not at all.
It's a deterioration of health that leads to an ER visit like 3 weeks later.
Exactly.
So today we are tearing into this really comprehensive guide from the NEMT platform. It's dated January 2026.
It's a great breakdown.
It really is. We're talking about non-emergency medical transportation, NEMT. And before you tune out thinking, this is just about medical taxis, let's be clear. Our mission today is to unpack how this system actually works.
Because it is undergoing a massive shift.
Right. The logistics, the costs, the safety measures, and why it is so distinct from both an ambulance and an Uber.
It really is the logistics layer of healthcare. And if you're following this space, it's currently this huge battleground between traditional providers, tech disruptors, and the insurance brokers who are basically holding the purse strings.
Right. So let's start with the definition, the what and the why. But I want to look at it through an operator's lens. NEMT. We know it's not an ambulance, but where is the hard line actually drawn?
It's a strict line.
Because I feel like there's a gray area where non-emergency starts to feel pretty urgent if you're the actual patient,
Well, the distinction is purely clinical. Ambulances are life support units. They have paramedics, defibrillators, and the legal authority to break traffic laws.
Sirens and lights.
Right. NEMT is effectively a curb-to-curb or door-to-door service for scheduled care. So if a patient is stable, meaning they aren't going to crash en route, but they have a mobility barrier preventing them from using a standard sedan, that is the NEMT use case.
Stable being the operative word there.
Exactly. Stability is the legal threshold. If you need medical intervention during the ride, you technically need an ambulance, or at least basic life support transport.
So it's not for checking a cold, but it's not for a heart attack either.
Right. NEMT is for the patient who needs a wheelchair lift, or maybe a stretcher because they can't sit up for 40 minutes, but they don't need a medic monitoring their heart rate every 30 seconds.
So it's really about the hardware and the hands-on assistance, not the speed.
Speed is actually the enemy here.
Really?
Yeah. NEMT prioritizes safety and smoothness over arrival time. You cannot speed with a bariatric patient secured in the back of a van.
Let's talk about that hardware, actually, because the guide highlights the fleet diversity. And we aren't just talking about a minivan with a ramp anymore.
No, not at all. The capital investment in these fleets is significant. You have your standard wheelchair vans, sure, but look at the bariatric market.
Which is growing.
Rapidly. We have an obesity crisis in many parts of the world, and standard equipment just fails. Bariatric transport requires reinforced lifts, wider vehicle chassis, and specialized securing systems.
Wow.
It's a massive bottleneck in hospital discharges right now. You have patients stuck in beds simply because no vehicle can legally move them.
Because a standard rideshare or even a standard NEMT van just can't handle the weight load safely.
It's a huge liability nightmare. If you put a 400-pound patient on a lift rated for 300 and it fails, that's a lawsuit that bankrupts the provider.
Right.
So the specialized fleet is where the real value and the real cost lives.
And then you have the stretcher vans, too. The guide mentions those.
Yeah.
This is for people who are bedbound, but, again, not dying.
Right. Think of a patient going from a hospital to a nursing facility.
Yeah.
They literally can't sit in a wheelchair. They need to be prone.
Yeah.
NEMT fills that specific gap where an ambulance is total overkill and wildly expensive, but a normal car is just physically impossible.
So it's really a lifeline for seniors and people with severe mobility challenges.
Absolutely.
So we've established the what, it's specialized logistics. Let's talk about the how, because this is where the 2026 source material suggests things are really changing.
The tech side.
Yeah, it mentions mobile apps and tracking. And my question is this actually functional tech, or is it just a glossy interface slapped on top of some old dispatch system?
It's definitely getting better, but I'll be honest, it's not exactly consumer rideshare 2.0. You have to understand the back end of this.
Okay.
When you order a ride to a restaurant, the app just needs to know your location. When you book an NEMT ride, that app needs to be HIPAA compliant.
Oh, of course. Data privacy.
Exactly. And it often needs to interface directly with a hospital's electronic health record, the EHR, just to verify the appointment actually exists.
Like, why? Because of fraud.
Fraud is a massive driver of the tech stack in this industry. In the past, people would book medical rides to go to the grocery store or even the casino.
You're kidding.
No, it was a huge issue. So now the tech is trying to close that loop. The app verifies the appointment time, the exact location, and the expected duration.
Okay, so the user experience now includes booking and managing appointments directly from a device. And the guide mentions tracking the vehicle, too, which seems basic to us, but for this demographic, it's critical.
It's all about anxiety management.
Yeah.
Think about it. If you are a dialysis patient, you feel terrible after treatment. Standing on a curb for 20 minutes in the cold or rain is simply not an option.
Right, you're exhausted.
Exactly. So tracking allows the patient or the facility coordinator to time their exit perfectly. But, and the source guide is very honest about this, it is not on demand.
Yeah, that was my next point, actually. The guide mentions typical wait times ranging from 15 to 30 minutes.
Minimum, usually.
And in the age of your driver is 3 minutes away, that feels like an absolute eternity. Why is the latency so high?
It comes down to load time. An able-bodied passenger hops into a car in 10 seconds. Securing a wheelchair properly takes time.
Because of the straps?
Yeah, you have the 4-point tie-downs, the lap belt, the shoulder harness. It takes 5 to 10 minutes if the driver is doing it correctly and safely.
Wow.
So if a driver is doing back-to-back runs, that latency stacks up throughout the day.
So the efficiency of the whole system is physically capped by the reality of the passenger's needs.
You just can't optimize away the need for actual human care. And that leads to the availability issue, too. The guide notes that while major metros might have some 247 options for urgent non-emergencies, this is largely a business hours industry.
Which is a huge problem if your MRI is scheduled for 8 p.m. or if you have a late hospital discharge.
It is a major friction point. And if you are in a rural area, you are often relying on a single local provider. If they clock out at 6 p.m., you are just stuck.
Yeah.
The whole appification of the industry hasn't quite solved the rural density problem yet.
Speaking of distance and density, I really want to drill down on something in the guide that totally surprised me. Long-distance NEMT.
It's fascinating.
Because I assumed this was strictly local, like across town, maybe to the next county. But they're talking about interstate travel.
It is a rapidly growing niche. Think about how specialized medicine has become. Let's say you live in rural Wyoming, but you need a very specific neurospecialist at the Cleveland Clinic. How do you get there?
Well, you can't fly commercially if you're prone.
Exactly, because of your condition. No. And an air ambulance costs $20,000 to $50,000.
Oh, wow. So NEMT becomes the ground alternative. But logistically, driving a medically fragile patient 600 miles is a beast of a trip.
It's a completely different operational model. You aren't just sending a single driver. These long hauls often require team driving. 2 qualified drivers rotating shifts, and you have to plan specifically for medical stops.
Like bathroom breaks for an immobile patient.
Hygiene, medication administration, feeding. The vehicle itself needs to be equipped with high-capacity inverters to power medical devices.
Like oxygen concentrators.
Oxygen, wound vacs, monitors. Running for 12 to 15 hours straight. It is not just a long drive. It is literally a mobile care environment.
And the cost on that, I mean, I assume it's cheaper than a Learjet, but it cannot be cheap.
No. The guide pegs general local trips at around $30 to $100 out of pocket. But long distance is mileage-based. It can run into the thousands.
Still, compared to $30,000 for an air transport.
Exactly. It's the pragmatic middle ground.
Let's follow the money then. Because if a 10-mile trip involves a specialized van, a trained driver, and massive insurance liability, $30 honestly feels really low. Who is actually paying for this?
This is where it gets incredibly bureaucratic. The biggest payer in the space, by far, is Medicaid.
But not Medicare.
Generally, no. And this is the source of endless confusion for seniors. Original Medicare does not cover NEMT.
Wait, really?
Yes. They will cover the ambulance if you are dying, but they do not pay for you to get to your scheduled chemo appointment.
That seems like a massive oversight given the demographic we're talking about here.
It's a huge statutory gap. However, the guide points out that many Medicare Advantage plans, the private versions, have started adding NEMT as a supplemental benefit.
Because it saves them money.
Exactly. They realize that if they pay for you to get to the doctor, you don't end up in their ICU 3 weeks later.
Okay, so Medicaid covers it mostly. But the guide mentions a requirement called medical necessity. This goes back to the fraud issue we touched on earlier, right?
Yes. Medicaid is a federally mandated benefit for transportation, but it is strictly gatekept. You need documentation, usually a letter of medical necessity or a certification form signed by a healthcare provider.
And what does that document actually have to say? Just John Doe can't drive.
It has to be way more specific than that. It has to certify that the patient cannot utilize any other form of transport. If you can take the city bus, Medicaid wants you to take the city bus.
So the doctor has to swear you can't take the bus.
Right. The doctor has to certify that taking the bus would be detrimental to your specific health condition.
Okay, and what about the actual destination? You mentioned earlier you can't go to the casino. What about the pharmacy?
This brings up the billable code problem. NEMT is reimbursement-based. The driver basically gets paid for taking you to a service that has a billable medical code, like a standard doctor's visit.
Okay.
But a pharmacy pickup doesn't usually generate a medical claim in the exact same way. So often, the system will deny a ride strictly to the pharmacy unless it is tacked directly onto a doctor's visit.
That seems incredibly short-sighted. I mean, if you can't get your meds, you are just going to get sick again.
You are preaching to the choir. It is a rigid system that is really struggling to adapt to holistic patient care.
Let's talk about the brokers, because the guide touches on this too. I know from looking at the industry that most patients aren't calling Bob's local NEMT service directly. They are calling a hotline.
Correct. This is known as the Brokerage Model. State Medicaid programs hire these massive private companies to manage the entire transportation benefit. So you call the broker validates your medical eligibility, and then the broker puts your ride out to bid for the local fleets to pick up.
So that local driver's getting squeezed by a middleman.
It is a total volume game. The broker takes a cut off the top. This puts immense pressure on the local NEMT providers to keep their operational costs as low as possible.
Which feels risky.
Well, if we're being cynical, yes, it can sometimes lead to quality issues. Older vehicles, overscheduled drivers rushing.
And that transitions perfectly to the safety aspect. Because if you're putting an aging parent in a van, and you know the provider is being squeezed on margins by a broker, how do you know the driver behind the wheel is actually qualified?
It's a very valid concern.
The guide lists things like a valid driver's license and a clean driving record, which honestly feels like the bare minimum.
That is the bare minimum, but the industry standards and often the broker contracts themselves require much more than that. We are talking about specific training and certifications, programs like PASS, which stands for Passenger Assistance Safety and Sensitivity, or CTS, Certified Transport Specialist.
And what do those actually cover? Is it just, defensive driving? Don't crash the van?
No, it's heavily focused on patient handling and safety. How to operate a hydraulic wheelchair lift without pinching fingers or dropping the chair. How to secure the wheelchair inside so it doesn't tip over on a sharp turn.
Oh, that makes sense.
Even how to handle a medical episode like a seizure in the back seat.
So it's essentially paramedic-like training.
In terms of empathy and situational awareness, yes. But medically, no. They are not treating patients. But they absolutely have to be trained to recognize when a non-emergency suddenly becomes an emergency.
Right.
If a patient stops breathing en route, they need to know the strict protocol. Pull over, call 911, start CPR immediately.
The guide also emphasizes something called service levels. Curb to curb versus door to door versus door through door. This seems like a critical distinction that a lot of people probably miss when booking.
It is the #1 cause of consumer complaints in the industry. Curb to curb means exactly that. The driver stays at the car.
Okay.
So if you are in a wheelchair on the 3rd floor of an apartment building with no elevator assistance, that ride is completely useless to you.
But The user might just assume medical transport means they come get me from my bed.
which is door-through-door or bed-to-bed service. That level of service costs significantly more. And it requires higher liability insurance because the driver is physically entering a private residence and bearing the weight of the patient.
Right.
If you don't book the right level, the driver shows up, sees you aren't at the curb, and they have to leave. They mark it as a no-show.
And then you miss your appointment, you get sicker, and the whole vicious cycle continues.
Precisely. So the vetting process for a consumer isn't just, are they a safe driver? It is, do they offer the specific level of physical assistance I actually need?
How does a consumer even verify that? The guide mentions checking reviews, but going on Yelp seems highly unreliable for medical logistics.
Yelp is basically useless here. What you really need to verify is if they are an approved Medicaid or Medicare provider, even if you are paying privately out of your own pocket.
Oh, interesting. Why is that?
Because being in that government network means they have passed a rigorous credentialing audit. They've done the drug screens, the federal background checks, the mandatory state vehicle inspections. If they're just some guy with a van advertising on a local message board, stay far away.
That is a great tip. Okay, let's zoom out a bit.
Yeah.
We have this really complex ecosystem we've unpacked here. Specialized fleets, reluctant insurers, overworked brokers, high-tech tracking apps. When you synthesize this whole 2026 snapshot from the guide, what is the ultimate trajectory?
We are rapidly moving toward what the industry calls value-based care. Hospitals are finally waking up and realizing that they are losing millions of dollars simply because of missed appointments.
Yeah.
So we're starting to see health systems actually buying their own NEMT fleets, or at least integrating very deeply with these new tech platforms.
Basically, vertical integration. The hospital owns the van, so they can ensure the expensive MRI machine stays busy.
It is pure economic rationality. If an empty MRI slot costs the hospital $1,000 in lost revenue, paying $50 for an NEMT ride to get the patient there is an absolute no-brainer.
Right.
We are seeing the cost of transport shifting from being an insurance benefit to just a standard operational cost for the healthcare providers themselves.
And that shifts the whole incentive structure from do it as cheap as possible to make sure the ride actually happens.
Exactly.
Yeah.
And that is fundamentally good for the patient. It means much better reliability.
It effectively removes the transportation barrier by making it the hospital's problem to solve, not the sick patient's problem.
Correct. And with the data integration we talked about earlier, where the ride is automatically triggered by the appointment booking in the EHR, we could see a very near future where you don't even have to book a ride at all.
You just schedule your chemo, and the car automatically shows up.
Seamless integration. But until we get there, the burden is still heavily on the user to understand the system.
It really is. You have to know your funding source, you have to know your exact physical requirements, and you have to make sure you book the correct level of service.
It is a system that severely rewards the informed.
As is almost everything in healthcare, unfortunately.
Very true.
Well, this guide from the NEMT platform certainly pulls back the curtain on the underlying mechanics of it all. It shows that it's not just a simple taxi ride. It is a vital healthcare lifeline.
A lifeline with a whole lot of moving parts.
That is the reality. But before we wrap up, I want to leave you with a thought. We've talked about this future where the hospital commute is as seamless as ordering dinner on your phone.
The auto-booking future.
Exactly. If we actually reach a point where transportation is entirely frictionless, how will that change long-term patient outcomes? If the logistics of getting care become invisible, do we see chronic illnesses drop? Do life expectancies shift simply because the friction of the commute is gone?
It's a fascinating variable to consider. If access is truly guaranteed, the whole paradigm of preventative care changes.
Something to mull over. Hopefully this deep dive helps you navigate the gridlock if you or someone you know ever needs it. Knowing this option exists is a total game changer. Thanks for diving deep with us.
Safe travels.